Alberta Health Services. Healthy Albertans, healthy communities, together.
Good afternoon, everybody. My name is Linda Hughes. I'm Chair of Alberta Health Services Board, and I want to welcome everyone here at the 7th Street Plaza, as well as all those watching from across the province through Facebook Live. I'd like to acknowledge we're gathered here today on Treaty 6 and Métis Region 4 territory, a traditional meeting place and home for many Indigenous people. There are many good things happening in healthcare today, but I'd like to focus on one good news story. And on behalf of the AHS Board, send a big thank you to Stollery Children's Hospital Foundation for its remarkable commitment to improving child and adult mental health services in Edmonton and throughout Northern Alberta. Earlier this month, the foundation announced it's committed to investing $26 million into the development of a child and adolescent mental health centre to be built near Glenrose Rehab Hospital. That $26 million, to be raised over 5 years, is one of the largest commitments AHS has ever received, and it will help us build a facility that will be game-changing, a one-stop shop for a wide range of pediatric mental health services. It will include crisis services, including walk-in and urgent clinics, 101 inpatient beds, specialized outpatient clinics, a mobile response team, intensive school-based treatment, therapeutic recreation programs, and a family resource centre. Northern Albertans have said that mental health is a top priority for them and their families, and this project will directly address their stated needs for more comprehensive and integrated mental health services. The design phase of the project is expected to start in a few months, with construction slated to begin in 2021 and a completion date of 2024. Meanwhile, design and planning work on a Centre for Child and Adolescent Mental Health in Calgary is also underway. This 3-story, 3,200 square foot facility will have a program area on each level, including walk-in services, intensive community treatment, and a day hospital. Construction on the Calgary facility, fully funded by the Alberta Children's Hospital Foundation, is expected to start this fall. We're hoping the new centre will open in late 2021. Once open, these new facilities in Calgary and Edmonton are expected to provide mental health supports for thousands of young Albertans every year and meet the needs of families across the province. We couldn't have done this at all without our valued partners, the Stollery Children's Hospital Foundation and the Alberta Children's Hospital Foundation, and all their generous donors. So thank you to all of them for helping AHS help Alberta families. I'd also like to point out that our AHS advisory councils around the province have also been longtime advocates for enhanced mental health services, and their input played a key role in pushing Edmonton and Calgary centres for child and adolescent mental health. I'm going to pass the mic over to our President and CEO, Dr. Verna Yu, in a few moments. But first, I'd like to ask if everybody has the agenda. Could I ask someone to move approval of that agenda? Hugh, seconded. Glenda, all in favor? Thank you very much. Declaration of conflict of interest. Does anyone have a conflict of interest they'd like to declare at this time? Okay, hearing none, we'll move along. You've all seen the minutes, I think. They're in your packages of our last 3 meetings. Any issues or questions to raise about those minutes? Hearing none, could someone move approval? Richard? Seconded by Brenda. All in favor? Thank you. Those are passed. So with that, I'll pass it over to Verna.
Thank you, Linda, and welcome to everyone. As Linda mentioned, I'd like to talk a bit about our health advisory councils and the huge role that they play in bringing forward the voices of Albertans and advising AHS based on the feedback that they solicit from communities from across the province. Since last November, AHS has partnered with our 12 health advisory councils to host a series of community conversations around Alberta. These conversations bring together AHS zone leaders and community representatives, and together they're discussing ways to improve healthcare for all Albertans. It also gives Albertans an opportunity to provide input into many AHS planning initiatives, including the development of our upcoming 2020 to 2023 health and business plan. We've held 10 community conversations with 2 more slated for next month. Once all the conversations are complete, our community engagement team will look back to the community groups to share the information and ideas discussed to better support community-based wellness. At the same time, a summary of the conversations will be shared with our zones and operational leaders so that this input can be considered as they plan for the future of healthcare delivery. I'd like to thank our health advisory councils for their partnering with AHS on hosting these community conversations and for the important role that they play year-round in improving healthcare in communities across Alberta. I have a video that highlights what they do, why they do it. Please take a look.
In 2003, I had a massive heart attack. The type of heart attack that I had was a blockage of the left anterior descending artery, and that one is referred to commonly as the widowmaker. In most instances, the first symptom of blockage in that particular artery is death. I was whisked to Chinook Regional Hospital in Lethbridge and triaged through the emergency system there. And although I was flown on fixed-wing aircraft to Calgary the next day, Chinook Regional Hospital kept me alive in the ICU. After the heart attack itself, my life was affected in that I didn't have quite the same strength, the same pep, the same vigor. Some of that was helped by cardiac rehab. Certainly I had to make some lifestyle changes, but those changes were made successfully, and yeah, I have been moving forward ever since. I have been a member of the Oldman River Region Health Advisory Council since the fall of 2016. I thought that being on Health Advisory Council was an opportunity maybe to not only give back, but to influence how health services are being delivered in Oldman River Region based on pretty significant lived experience.
One of my favorite meetings of the year is actually meeting with the Health Advisory Council chairs. We've been very purposeful to make sure that the councils are very representative of Albertans. Every community is different. So if we don't really know what's important to Albertans, if we don't understand the communities they live in, the type of services they have or don't have, how do we know whether we're missing the mark or not?
I'm Lucille Partington, and I live in the north of Alberta in a town called Sexsmith, Alberta. I had 3 sons, and then that wasn't enough. So we adopted a beautiful daughter and 4 children in that family. Now we have the youngest grandchild. So I'm currently chair of the Peace Region and of course the co-chair of all of the Council of Chairs across the province. Really they're the voice of the community because they live across the whole province and are in touch every day with people that are using the healthcare system, and they know what works for them and what doesn't work. So it's our job to gather information about what's important in our regions of Alberta from the citizens.
I think people join the council because, like me, they have an interest in and willingness to give back to their community.
If I look at the members of our councils right now, what I really admire about them is their passion for the community and their passion for trying to make a difference. You know, at the end of the day, our success as a health system can only be judged by the users. And who are the users but Albertans?
We are, in the truest sense of the word, advisors. We are counselors. We are not executive bodies. We are not in any positions of authority. What we are is a sounding board for Alberta Health Services to gauge just what their thinking is going to look like in the real world and how it's going to be graded by people who will be affected by it.
Before I turn the mic back to Linda, I'd like to point out that AHS turns 10 years of age on April the 1st, and I'm very proud of what we've achieved over the past decade. I've recently given presentations in Edmonton and Calgary about our first 10 years and what the future has in store. And you can see my presentation on our website at ahs.ca/yourahs. But I'd like to highlight 2 achievements that have required long-term planning and focus. This month we learned rates for new cancer diagnosis and cancer deaths, and they continue on their decline. We monitor how many Albertans are newly diagnosed with cancer or die from cancer per 100,000 people. And the most recent statistics from 2016 are now available. The rate of new cancer diagnoses have dropped by about 0.5% annually between 2001 and 2016. And the mortality rate has dropped by about 2% annually between 2004 and 2016. That drop in mortality rate means that in 2016, 2,260 cancer patients or cancer deaths were avoided, deaths that would have happened otherwise in common forms of cancer like colon cancer, prostate, and breast. Meanwhile, Healthcare Quarterly this month published a case study that shows that AHS has developed one of the top health supply chain management programs in the world. And why should Albertans care? Because supply chain management ensures that patients get the right product, such as an implant, and that such products and devices are traceable to the patient in the event of a recall. It also helps in measuring outcomes to determine which products are most effective, so that those products are the ones that we use. And on top of that, AHS has saved more than $300 million over the last 7 years in efficiencies because of our excellence in supply chain management. Our decreasing cancer rates and our improving supply chain management requires commitment to long-term, province-wide strategies, and that's what we've done. I'd like to thank everyone involved in our Cancer Care Alberta programs and contracting, procurement, and supply management teams for their continued efforts. And thank you to all of you for listening today. So back to you, Linda.
Thank you, Verna. All right, we'll move to committee reports and start with Finance Committee. Glenda?
Thank you, Madam Chair. The Finance Committee met on February 6th, 2019, and the committee considered 4 items for recommendation for approval to the board. First, with respect to the AHS Investment Manager request for proposals, the committee was advised that AHS had issued a request for proposals for investment management services in October 2018. The RFP award recommendation is that Phillips Hager and North Investment Management be the preferred vendor. The board has been asked to accept this recommendation. Accordingly, I move that the AHS board accept the request for proposal award recommendation naming Phillips Hager and North Investment Management as the preferred vendor to negotiate an agreement to manage AHS's investments. I so move.
Thank you. Could I have a seconder? Richard? All in favor? That's carried. Thank you.
Next, with respect to the third quarter investment report, as mandated by AHS's investment bylaw, the committee is required to review reports prepared by management and investment managers summarizing the activities and performance of AHS's investment portfolio on a quarterly basis. The Regional Health Authority's regulation and the AHS investment bylaw describe the requirements for the board to approve or ratify by resolution AHS's investment decisions. The committee was presented the 2018-19 third quarter investment report and recommends that the board ratify the transactions. Accordingly, I move that the AHS board ratify the investment portfolio and transactions as described below and as certified by signed investment compliance certificates from AHS and Phillips Hager and North Investment Management. 1. As at December 31st, 2018, AHS held restricted and unrestricted funds managed by Phillips Hager and North Investment Management and Manulife Financial, totaling $1.35 billion. 2. The funds were invested in short-term treasury bills, federal, provincial, and corporate fixed income bonds, pooled mortgage funds, bond funds, Canadian and global equity funds. And 3. All of the funds invested during the quarter ending December 31st, 2018, were invested in accordance with the investment bylaw and investments policy as certified by signed investment compliance certificates from AHS and Phillips Hager and North. I so move.
Thank you. Could I have a seconder? Hugh? All in favor? Great, thank you. That's carried.
Thirdly, with respect to revisions to the AHS investment bylaw and the AHS investment policy, the committee reviewed proposed revisions to the AHS investment bylaw and the AHS investments policy that primarily relate to prohibited investments and clarify permitted direct and indirect investments. The committee recommended the board approve the proposed amendments to the AHS investment bylaw and the AHS investment policy. The amended bylaw will then be sent to the Minister of Health for approval. Accordingly, I move that 1. The AHS Board approve the amended AHS investment bylaw and investments policy on substantially the terms and conditions reviewed by the Board, with such non-substantive changes that management of AHS considers necessary or advisable. And 2. Authorize management to submit the amended AHS investment bylaw to the Minister of Health for approval. I so move.
Thank you. Seconder? Hugh? All in favor? Thank you.
And finally, the committee considered the approval with respect to amendments to continuing care contracts that require board approval. The committee recommends that the board approve such amendments. Accordingly, I move that the AHS board approve amendments to the following agreements as follows. Number 1, with respect to the master services agreement with Covenant Care, 1. Amend and extend hospice services at Dulcina Hospice at St. Marguerite facility in Calgary for 5 years and 9 months. 2. Amend to add supportive living level 4 spaces at Villa Marie facility in Red Deer. And 3. Amend to add supportive living level 4 spaces at St. Thomas facility in Edmonton. 2. With respect to the master services agreement with Alberta Life Care Housing Foundation, 1. Amend to add a new supportive living level 4 and 4D spaces at the new chateau at Chauncey Square facility in Edmonton. And 3. With respect to the master services agreement with CBI Limited, 1. Amend and restate 2 separate MSAs, master services agreements, under one MSA for home care services in Edmonton and Calgary, and 2. Add a new home care service schedule for the delivery of existing CBI Limited services in Lethbridge for a 1-year term. And 4, delegate signing authority to the AHS President and Chief Executive Officer to effect such amendments as listed above. I so move.
Thank you. Seconder? Marlis? All in favor? Thank you. That's carried. And now Audit Committee, which is over to you again.
Thank you, Madam Chair. The Audit and Risk Committee met on February 6th, 2019. Standard practice is that staff from the Office of the Auditor General and KPMG are guests at the meeting in their role as external auditors of AHS. The committee discussed audit matters, including external auditor evaluation, Alberta Public Health Laboratories Limited e-People implementation, and a quarterly report on the activities of the AHS Internal Audit and Enterprise Risk Management team. There were no items that came through the committee for board approval. So that is my report, Madam Chair.
Thank you very much for that. All right, moving on to our Community Engagement Committee. Brenda?
Thank you, Madam Chair. The Community Engagement Committee met on February 14th, 2019 and February 20th, 2019. Representatives from the Greater Edmonton Health Advisory Council and the Alberta Children's Hospital Foundation attended the February 14th meeting. The committee considered 3 items for recommendation for approval of the board with respect to appointments to foundations, health advisory councils, and the new Provincial Advisory Council on sexual orientation, gender identity, and expression. We're very grateful for commitment of our volunteers across the province. We value their work and appreciate their commitment to health care in the province. Given the number of appointments to these entities, the names will not be read at this meeting, but will be incorporated into the minutes of the meeting and posted publicly. First, with respect to appointment of trustees to foundations, the responsibility to appoint trustees to established foundations lies with the AHS board. The committee reviewed proposed amendments and recommended the board approve the same. Accordingly, I move that the Alberta Health Services Board approve the appointment of trustees to health foundations effective March 1, 2019, for the terms as reviewed by the committee and the Alberta Health Services Board. I so move.
Thank you. Could I have a seconder? Glenda? All in favor? Thank you. That's carried.
Next, with respect to Health Advisory Council new member appointments, the amended bylaw for Alberta Health Services establishing health advisory councils indicates advisory council shall have a membership of 10 to 15 people. Council members are appointed for 3 years to a maximum of 6 years, unless otherwise determined by the board. The committee reviewed the proposed appointments and recommended the board approve the same. Accordingly, I move that the Alberta Health Services Board approve the appointment of members to the Health Advisory Councils effective March 1, 2019 for 3-year terms as reviewed by the committee and the Alberta Health Services Board. I so move.
Thank you. Could I have a seconder? Hugh? All in favor? Thank you. That's carried.
And as a final matter, the committee considered new member appointments to the Sexual Orientation, Gender Identity and Expression Provincial Advisory Council. The bylaw for the Provincial Advisory Council on Sexual Orientation, Gender Identity and Expression was approved by the AHS Board on December 12, 2018, and by the Minister of Health on February 4, 2019. The committee reviewed proposed membership appointments and recommended the board approve the same. Accordingly, I move that the Alberta Health Services Board approve the new member appointments to the Sexual Orientation, Gender Identity and Expression Provincial Advisory Councils effective March 1, 2019 for the terms as reviewed by the committee and the Alberta Health Services Board. I so move.
Thank you. Could I have a seconder? Marlis. All in favor? Thank you. That's carried. And now, finally, Governance Committee. Hugh?
Thank you, Madam Chair. The Governance Committee last met on February 14 of 2019. In addition to receiving the quarterly update from the Chief Ethics and Compliance Officer, the committee also received updates on Accreditation Canada and the status of revisions to the Mandate and Roles document. There were no items that came through the committee requiring board approval. So that is my report. Thank you.
Thank you. Short but sweet. So now I move the meeting adjourned. Thank you very much.
Together, we do amazing things every day.